everyone. I'm Joe Magliocco with Blue Matter Consulting, and today we are going to talk about the latest factor in our series on the make or break factors for a company on the journey from R&D to commercial. Today we're going to talk about Factor 5, choosing the best path forward towards commercialization or revenue. Essentially, there are four main types of options that an emerging company can use to realize revenue. They can launch on their own without a partner. They can launch while outsourcing some or all commercialization capabilities to one or more partners. They can fully out-license an asset, or they can try and get acquired. There can be increased complexity when you think about pursuing different paths forward across different geographies. But ultimately, some of that complexity gets reduced when we look at historical trends. Pretty typically, if a company does not get acquired, they will launch alone in the US, and they will engage in some sort of partnership outside of the US. And this is because the US as the largest market is often worth building infrastructure and finding select partners to help with some commercialization capabilities, like a specialty pharmacy to support access and reimbursement. Whereas ex-US, the infrastructure required to address many more and much more diverse markets remains an investment that many companies are not willing to make. That being said, it's important to really think through whether the typical model is the right model for your company. There are a number of considerations for why a company might not follow this path that we typically see. One set of considerations is all around the needs of the organization, starting with, do we even want to become a commercial company? Do we have the financial ability to become a commercial company? And is it the right investment compared to everything else that we have on our plates? The second set of considerations is all around the product. What is the life cycle of this product? Are there more indications coming later where it's worth building the infrastructure now because we're setting up for something bigger longer term? Or conversely, are those indications, those future launches coming much later? And as a result, it's better to find some sort of partnership in the near term that will help us manage our investment until bigger indications launch after a few years. And the last set of considerations is all around the market. Are patients and prescribers heavily concentrated, in which case we can deploy resources very efficiently to capture that opportunity? Or are those stakeholders very dispersed, where we need to invest in significantly more sales and marketing infrastructure, for example? Or is there really high competition where we're going to want more share of voice than we're able to provide as a small company? Regardless of the preferred path forward, we always recommend that companies are prepared to go alone, at least in the US, that they understand what it takes. And this is for a couple of reasons. First, you may want to have a partner or you may want to out-license, but you might not find the right partner with the right deal terms. Or you might find a partner who eventually backs out, and so you need to be ready to do it yourself. Maybe last and somewhat most importantly, if you're not setting yourself up to go alone, when you get to the table for negotiations, you might be in a weaker position because your partner knows that without them, you're not going to be able to launch this product on your own. So we outline a lot more of this in detail in the article. Please click the link below to read more, and don't hesitate to reach out with any questions.